everyone. Thanks for joining me for ASAP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Worcester. So for the next 30 minutes or so, I'm going to give you an update of what's happening in our nation's capital, and then we'll open it up for questions. You can submit them at any time during my update by using the Q&A feature at the bottom of your screen in Zoom, and then I can answer them live after my update. Here's a taste of what we'll cover today, such as recent data changes by the CDC, physician mental health, the Senate's COVID-19 relief package, an update on PPE, and our new August recess spokesperson toolkit. HHS made waves recently when it announced a change in how states and hospitals are to report critical data about the COVID-19 pandemic. Instead of reporting data to the CDC's National Health Safety Network, states must now report data from hospitals directly to the HHS Protect system or a system week, Dr. Redfield publicly stated that the CDC will still be able to conduct the public analyses that the agency releases on a...
Hey, Laura.
All right, sorry about that. I have some broadband issues today. I'll back up a little bit, but talking about the CDC's data issues, last week, since it announced the change, CDC's director, Dr. Robert Redfield, and other Trump administration officials have defended the move. There we go. Here we go, I think. Okay. So last week, Dr. Redfield publicly stated that the CDC will still be able to conduct the public analyses that the agency has been releasing on a routine basis throughout the pandemic. But despite the reassurances from Dr. Redfield and others, ASAP is concerned and immediately arranged a call with the CDC last Thursday to discuss the full implications of this policy change. Unfortunately, CDC staff were actually unable to answer many of our initial questions about how the change would impact the CDC's and the public's access to the data, since many of the operational details were still being worked out with this sudden change. ASAP's committed to keeping you updated and continuing to reiterate to the administration officials that having full access to data is absolutely critical as our nation responds to this unprecedented crisis. But in the meantime, please let us know if you have any particular questions you want us to raise with the CDC or other federal agencies, or if you are having trouble accessing certain information that you need to help inform your response efforts. We also have an update on our continued priority, physician mental health, and breaking down barriers for you and your colleagues to be able to seek treatment when you need it. I'm very pleased to share that yesterday, after weeks of tireless efforts from ASAP, the Dr. Lorna Breen Healthcare Provider Protection Act was introduced in the Senate. Named after ASAP member Dr. Lorna Breen, this bipartisan bill would create behavioral health and well-being training programs through health departments and medical or nursing schools for healthcare professionals to reduce and prevent suicide, burnout, and other behavioral health conditions. It would establish a national education and awareness campaign to encourage healthcare professionals to seek support and treatment. It requires HHS to do a comprehensive study and develop recommendations on healthcare professional mental and behavioral health and burnout, including the impact of the COVID-19 pandemic on such professionals' health. And it would award grants to healthcare providers, including medical professional associations, to establish or expand mental health support services to those providing care to COVID patients. ASAP worked with Senators Tim Kaine and Jack Reed on the legislation, and we were able to secure some important provisions in it, including that the HHS study specifically examined concerns related to licensing and credentialing as a barrier to accessing mental health treatment, and to expand eligibility for the grants to medical professional associations such as ASAP. More importantly, we are now working to advocate for its inclusion in the next COVID relief package. If you want to send a message to Congress supporting such actions, please visit the link on your screen. As well, if you've ever had difficulty accessing mental health yourself due to concerns of licensure or credentialing impacts, or have actually faced those impacts as a result of seeking care, You can actually help strengthen ACEP's advocacy by anonymously sharing your story at the other link on your screen. Moving on Monday, Senate Republicans released their $1 trillion COVID relief package. The proposal is made up of several bills that are collectively being referred to as the HEALS Act. While the first three major COVID response legislative proposals were approved by Congress with large bipartisan majorities, this round of discussions is going to be much more challenging. While a few Senate Republicans don't want to do another relief package at all, others do, but they believe the $1 trillion cost to the government for the legislation that's currently proposed is too much. For reference, the House Democratic bill, the HEROES Act, which was introduced early last month, included $3 trillion in funding and program support. One significant ACEP-supported proposal that was included in the HEALS Act but was not in the House bill would provide liability protections for emergency physicians, other healthcare providers, businesses, and schools arising from COVID. ACEP will be monitoring the House-Senate negotiations on this package really closely and will be advocating to make sure the provisions most favorable to emergency medicine from both bills make it into the final version that's signed into law. In addition to liability protections, we're tracking inclusion of other ACEP priorities for the legislation, including mental health support services for frontline physicians, testing and tracing, state and local support, hazard pay, telehealth services, and access to PPE, among other things. Speaking of PPE, we know that PPE shortages continue to be an issue across the country. In addition to prioritizing PPE access in the next congressional relief package, we're also working on the regulatory side to get you and your teams the protective equipment you need. On July 16th, ACEP President Dr. Bill Jaquist and ACEP staff met with officials from the Occupational Safety and Health Administration, or OSHA. During the meeting, ACEP shared de-identified stories from emergency physicians that we collected who've been penalized by their hospitals for bringing in and wearing their own PPE or for speaking out publicly about PPE shortages or other issues. We strongly urged OSHA to revise their standards and guidance to better protect emergency physicians and reinforce their right to wear the PPE that they believe keeps them safe. We also asked OSHA to respond as quickly as possible to formal complaints that have been filed by emergency physicians. OSHA appreciated hearing directly from ACEP on these issues. The agency told us that it's working on additional guidance around the appropriate use of respirators and, in light of our comments, we'll start examining other guidance documents around PPE to try to address our concerns more quickly. OSHA is also actively responding to complaints and encourages emergency physicians to continue filing complaints if they feel that their rights have been violated. To file your own OSHA complaint, please use the link on the screen. As we head into August and Congress adjourns for the month, now is a good opportunity for you to speak with media and legislators about emergency medicine priorities and help advocate for emergency medicine altogether. We've updated our ACEP COVID-19 spokesperson toolkit on ACEP's COVID-19 Media Hub webpage. There you can find patient resources and talking points on our key priorities. For the general public, we're encouraging you to talk about two of our ongoing PR campaigns, Stay Safe, Cover Your Face, which encourages people to cover their faces when in public and engage in other smart behaviors like social distancing to stop the spread of the virus. And then our ER Safe campaign is aimed at quelling fears patients may have about contracting COVID-19 and encouraging people not to delay going to the ED in case of a medical emergency. And we also have our public talking points for our PPE efforts. For policymakers, we also have talking points for our advocacy efforts related to PPE, physician mental health, testing and the supply chain for it, and financial support in the pandemic for emergency physicians and groups. That wraps up our federal advocacy updates, so I can start taking your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. Let's see which questions have come in. All right, let's see. That my video hasn't been working. Nope. All right, does ACEP think the changes to CDC data collection will impact data collection or access to information? So it's too soon to tell, really, because this is such a big change. It's taking a while to implement, so we haven't really seen enough of data coming from the new system to really understand how it's impacting data collection, if at all. or if access to information is going to be more limited following this change. We're definitely concerned about it, so we're keeping a very close eye on it, and we'll continue to stay in touch with the CDC and HHS on it, and more importantly with some of our academic members who rely on this data and have been using it and might be more able to tell us what some of the changes in their day-to-day use of it have been. Okay. So another question is, how would you broadly characterize the Hill recognition of mental health challenges? Is there momentum for change? Do credentialing entities want to improve? I would say the Hill recognition of mental health challenges is now growing as a result of this advocacy. I think it's something that they were kind of aware of in the background. You know, I think they've heard of provider burnout amongst all the different medical professions. And they knew about it, but I don't think it was really something that was taken seriously because day to day, the general public and lawmakers, I don't think they really understood what burnout actually means in terms of the long-term well-being of medical professionals, and then by virtue of that, their patients. So I think the pandemic itself has really helped solidify the importance of clinician well-being for lawmakers. So I think they are paying attention now. I think we've seen, even before ACEP's advocacy and the work by several members of Congress, both in the House and Senate, on this legislation to help protect and improve mental well-being for frontline clinicians. Even before that, we saw the general public kind of recognizing the heroic acts that a lot of frontline clinicians have played in this pandemic, and the sacrifices that they're making. So I think this is a good time to get even more recognition of that, and then more importantly, to advance actual change as a result of it. In terms of the credentialing entities wanting to improve, I think they do. I think probably it's been a little bit held up by, you know, what they can do. And I think now if they start to get some pressure from lawmakers, policymakers, and the general public, they might start to make more changes. All right. Another question. You mentioned federal efforts supported by the Dr. Breen bill. What would ACEP want to see coming out of an HHS study? So I think there's a few different things we'd want to see coming out of a study. First, we'd want, I think, some data findings and statistics that show how widespread this issue is, based on what we know and what we hear from our members and ACEP leadership. This is obviously a very widespread, significant issue, but I think having statistics to back that up will help in advocacy and ensure long-term change both at the federal and at the state level. So we'd want to see some statistics coming out of that. We'd also want to see the study identify specifically some of the barriers that we've observed in terms of licensure, state licensure, some of the kind of really intrusive questions about even past mental health treatment, even if it was years ago, and the impact that could have on licensure renewals or applications, and then the credentialing process. So we'd want to see those identified in the study, because that kind of helps codify that when ACEP says this is a problem, it actually is a problem, right? Now a federal entity has said that. And then not just, we don't want the study to just kind of identify these things, but we want it to make recommendations for changes, because again, that can help spur actual change. HHS does a study, they find these are the barriers, but then they also recommend ways that those barriers can be overcome. And then ACEP can then translate into that into actual action at the federal level and at the state level. So another question is, how likely is it that physician mental health provisions get included in COVID relief? I think there's a good chance. I don't think it's a slam dunk. That's not because there isn't the political will for it on Capitol Hill. It's more that this COVID relief package, much more than the previous three, is already really controversial. So this is the Senate Republican COVID relief package. And over the last 3 days since it was released, there's probably been more disagreement and dissent and criticisms about the package coming from Senate Republicans themselves than anybody else. So I think it's already just a tall hill to climb for something to get done, depending, and then regardless of what it looks like. And then there's the complications of having to join it with the House Democratic proposal, which was somewhat political as well, and then trying to keep the costs down. So we're really hopeful, though. I think there is a lot of political will for it to get done. ASAP, we're speaking with the healthcare committees of jurisdiction this week and next to emphasize how important this legislation is and how impactful it can really be. So we really are hopeful that we can get it included. We also have our grassroots alert that's gone out, and that was included on the slides to take action. And if you can write to your member of Congress and encourage them to take action on this and ask their leadership to make sure that this is included in the next COVID relief package, that will also really help. And coming from emergency physicians as a constituent, your voice is actually going to be really powerful in this. So do lawmakers appreciate the importance of strengthening liability protection or hazard pay? Those are two very different questions, so I'll take them separately. But in terms of the importance of strengthening liability protection, so I think what can happen is the liability protections that were included in the Senate Republican package, they are well structured for helping to address the problems that emergency physicians are facing in this pandemic, but they're included kind of lumped together with liability protections for offices, factories, manufacturers, things like that. And I think that what may happen is that concerns for worker safety, that these other liability protections for employers would provide, may kind of override where the kind of more common sense, viewed as more common sense by many lawmakers, liability protections that we are asking for pandemic care are viewed. So basically the kind of more extreme from the perspective of some liability protections that are included in the package may kind of drag down the common sense, narrow pandemic related liability protections for emergency physicians and other frontline clinicians in the pandemic. So I think there's some risk there. Kind of on the flip side though, if the other liability protections are way too much for, let's say, some of the Democrats in Congress who haven't really been as favorable with liability reform to stomach, there may be an opportunity for kind of a compromise in that the narrow healthcare ones that we are advocating for can stay in, which allows Leader McConnell to still kind of be able to say that he got liability reform protections done in this package. But some of those other ones that were a little too kind of extreme or controversial are the ones that get dropped kind of to save the whole thing. So we'll see on that. In terms of hazard pay, I definitely think lawmakers appreciate the importance of hazard pay. It's just kind of what, as seems to happen so often, it's getting a little bit bogged down, I think, in having to pick winners and losers. So who, from the eyes of the lawmakers, who deserves hazard pay? Why is it, I'm just giving examples, an emergency physician, but not a grocery worker who is providing an essential service because people still need to eat during the pandemic, and vice versa. And then there's also, how can you structure it? If it's a flat dollar value, there's no flat dollar amount that the government could afford realistically that would be meaningful to both the grocery worker and, for example, the emergency physician. So that gets complicated. And if you do it as a percentage of salary, let's say, right, that could get expensive as well. for the government to provide. So I think they definitely appreciate the importance of it, and they want to be able to help people who've been on the front lines. But I think the devil's in the details, and the controversy that kind of surrounds it is kind of likely to kind of pull it down, I think. Another question is, has OSHA been collaborative with respect to physician complaints? Are we seeing any increased accountability? So they've definitely been collaborative on this. And one of the things that really made a big difference was ACEP had reached out several months ago after we heard from some of our members that they were facing punishment from their hospitals or workplaces for wearing PPE that they'd been able to bring from home when the hospital, had shortages. And what we did then was put out a general call for stories. We assured everybody that we would keep your identity and any identifying details in these stories anonymous. And we packaged those up, and then we shared them with OSHA and actually several other agencies, as well as the American Hospital Association and the Joint Commission. And we got a lot of really positive responses from those stories, in that they had no idea that this was happening or how bad some of this was. And it really helped make the difference. We saw the Joint Commission weigh in on this to protect your rights to bring PPE from home when there's shortages. And then OSHA themselves, they said in the meeting last week or 2 weeks ago that that was very, very helpful to see these examples. So it's just another kind of illustrative example of the power of storytelling and advocacy. And we're trying to do that same thing now in collecting these anonymous stories about physicians who've been hesitant to seek mental health treatment as a result of some of the licensure and credentialing potential implications. So we're trying to do the same thing in collecting those stories, because we think it'll really help crystallize some of the advocacy on that issue. Another question is, thank you for this toolkit. That's our spokesperson toolkit that we talked about earlier. Where can I find it? What's the best way to work with ACEP to tell my story? So the toolkit is on ACEP's Media Hub, and that you can get to if you go to acep.org/COVID-19. You can navigate from there to the ACEP COVID-19 Media Hub. And that's a collection of stories that ACEP has worked on, or that highlights the many of our members that have been speaking to the media all throughout this pandemic. So you can see those stories there, and then you can also find the toolkit there. In terms of what's the best way to work with ACEP to tell your story, go through the toolkit, take a look at it. If you have questions on anything or what you should say, or if you're approached by media, especially local media, and you're not sure whether or not you should speak to them or what you should do to prepare, just shoot us an email at pr@acep.org, and we can help you out with that and give you some advice. We also encourage folks to join ACEP's spokesperson network, and you can find more information about that on acep.org as well. That's kind of a more long-term approach. But in the long term, that can really help as well to tell your story. So I definitely encourage you to check that out. All right. Another question is, what is ACEP doing to address all the misinformation out there today? This is definitely a significant problem. And what we've been doing all throughout the pandemic is we have two main websites for ACEP for emergency physicians. The first is acep.org, which is our member-facing website for members like you, which obviously have a lot of resources that are directed at you. But for consumers, the general public, and even lawmakers and the media, we have emergencyphysicians.org. And that's where we put a lot of our consumer-facing content and kind of messages to the public. During non-pandemic times, that's been like health and safety tips, things about kind of seasonal issues that tend to come up, like 4th of July safety, safety around the holidays. And so we now have a whole page there about some common misinformation that clarifies that. So definitely, if you're interested in seeing what ACEP has been doing on that, definitely check out that website. We also this morning put out a press release just talking about how damaging misinformation can be in this pandemic and the importance of making sure that resources and sources of information are accurate and vetted. All right, see if there's any more questions coming in. What are your thoughts on the impact of the coming election on our advocacy priorities? It's a good question. The coming election will definitely have an impact on our advocacy priorities. In normal times, it would have anyway, of course, because we are potentially facing a change in party in, at minimum, the Senate and in the presidency. The House is expected to probably stay in control of Democrats, although the margin by which they're in control could increase or lessen, which does impact some of our advocacy work. But in terms of if the Senate were to change control to Democrats, you now have both chambers in Congress in control of one party, which kind of changes the direction your advocacy can take and makes, a lot of times can make it more likely for legislation to be passed. So there's more activity in Congress. That's not necessarily the case because you still have to kind of have the margin by which a party controls either of the chambers. If it's only a small margin, it actually can sometimes make more gridlock and less gets done. But we'll see kind of where that is. And then of course, if the presidency changes over, that'll have very big implications. And that's not just a change in party, it's a change in the sitting president versus the second term. So that certainly changes who we work with in the administration and the direction that that goes. In terms of this election, obviously with COVID-19, there's going to be a different focus, I think, following the election if Democrats take control. Certainly if they take control of both the House, the Senate, and the presidency, but even if it's just the presidency and they maintain control of the House, you will definitely see a renewed or more of a, I would say, mainstream look at things like either Medicare for all or a public option. I think the COVID-19 has shown as unemployment grows as a result of COVID-19 and people are losing their employer-sponsored health coverage, I think it's showing even more the vulnerability that our kind of the health system that we have where most folks have coverage through their employer. That's created a huge vulnerability during a mass either sickness event or disaster, because those often lead to unemployment. And then now you have sick people and you have unemployment and you have no health insurance. And that's just not sustainable. Right now, we've had in the previous COVID packages that the federal government is stepping in to cover at least COVID-related care for folks who have lost coverage, but that's not sustainable in the long term. So I think there will definitely be a renewed push for something like either Medicare for all or a public option as a result of all this. And I think it will, different than we would have expected 9 months ago, it will certainly have much more of a mainstream, I think, it'll be much more of a mainstream conversation versus kind of the further left side of the Democratic Party. So we'll see how that goes. So last question, it sounds like now is a critical time for advocacy. What's the best way for me to get in front of my member of Congress? Well, no one's going to get physically in front of a member of Congress right now for obvious reasons, but August recess is coming up very quickly. We actually don't know exactly when Congress is going to break, but it's looking like they recognize they won't be able to vote on the fourth COVID package before leaving. It's just way too much work left on that. So it could be in the next week or so. But once they go home, most of them have, for the large part, been home unless they come back to DC for votes. But that's the time where they are campaigning right now, especially with the elections coming up. And so they'll have a lot of opportunities for you to interface with them. Most of this is now going to be virtual, but that's actually okay. It makes it even easier for you. And so just the best way is to get on your member of Congress's, look up who your member of Congress is. You can get on their websites, and if they have any town halls advertised, there'll be virtual town halls right now. We really encourage you to sign up for those. Another way that you can become active and get in front of your member of Congress is, if you haven't already, join NEMPAC, ASAP's Political Action Committee. By joining NEMPAC, you'll have a lot of opportunities to interface with members of Congress in your district. And we have a lot of resources that help you get ready and figure out how to do that. And then the last step is we would encourage you to sign up for ASAP's 911 network. And that's, you can reach that at asap.org/advocacy. And our 911 network, that's where you'll see our legislative alerts go out, where we ask you to write to your member of Congress, like we've asked folks to do on the Dr. Lorna Breen bill. And you'll also get our weekly updates, probably not during recess, but we, outside of recess, we usually send out our 911 update, which goes out weekly and gives an update on what's happening in DC that impacts emergency physicians. So that's it for today. We'll be back next week, actually, and then we'll return to our regular bi-weekly schedule. So we look forward to seeing you next Thursday. Thanks, everyone.